Good morning, everyone. I'm back again. In case you didn't meet me when you came in, my name is Darcy Fernandez, and I'm the principal here at Roosevelt Middle School. And I'm very excited to have each and every one of you here today. One of the reasons why I was so excited when Marianne and Pauline came to me to host this event is because at Roosevelt Middle School, long before I arrived, they have been working diligently in getting the students here really interested in their own physical health. And we have some real leaders in our building around that. And that really, when I got here, was already embedded, and I just had the opportunity to enhance it when I arrived. At Roosevelt, when we open, what we talk to kids about is the fact that we really see three key pieces to their healthy living: healthy body, healthy spirit, and healthy mind. And we really try our best to try to incorporate all those concepts to the children. Also here at Roosevelt, what's so interesting is we have a very diverse population. Some people aren't aware of that. We are the immigrant school for the city. All the students where English isn't the first language come here. So at the elementary, they may be spread to 5, 6 different schools. Then they all arrive at our door through the middle school years, and then they go on to the high school. So we have a large number of students who come who are getting health access for the first time once they arrive here. Simple things like getting their teeth fixed, getting their immunization shots, and so forth. These students haven't had. Example, I met yesterday with a parent from Guatemala, and we talked for about an hour. And what we found out in the conversation is this young lady had been isolated on a farm from birth, had never had a formal education, had never even had a formal health check. And ultimately, so when I heard about the Health Equity Committee, I wanted to get involved because I knew that our children needed that. They needed access to this because for a lot of our families, their hub and their experience here in the United States really starts at the school. Ultimately, this is the first place they really introduced to formalized governments of some type and really use us as a vehicle of access. And so getting involved in this was very important, one, for that reason. The other reason is the influences here at the school really helped me to be much more healthy. Most of you have not known me for a long time, but for those who have, they know I've lost over 106 pounds. And the majority of it has been since I've arrived here at the school, and I really want to thank Mrs. Dixon and Mrs. Pino, our school nurse, and such, who really helped me to become more aware of my own physical health and what I needed to do. But interestingly enough, what a lot of people don't know about me is why I was so physically a mess. There was a lot of mental health issues that were related to that. I was a victim of rape at a young age. And ultimately, I had to really cope with that in order to cope with the physical health. So they go together, they're not separate. And without having the opportunity to really deal with one and the other, things fall apart. And so at Roosevelt, not only have we been really thinking about the physical health, we've been thinking about the mental health. We have partners who have been working very closely with us here at the school, who I can't thank enough for bringing and helping to build those bridges for our children. Because what we are finding, particularly in our immigrant populations from third world countries, that a lot of our young women and our young men are victims to rape as well. And ultimately, a lot of the crisis that they're in is related to that mental health issue that has to be fixed. First, here today is one of our partners in this work that we're doing is the Immigrants Assistance Center. And I just want to take a minute to recognize them, because when you walked in today, what you noticed is we have the Amigo Center. That was not here when I arrived. And that's an access point for our families where English isn't the first language. They now have a hotline that they can call, and they can check in, and they can actually speak to somebody who speaks their own language and talk about what their issues are. And then the Immigrants Assistance Center will work with them to help get their assistance. An example last year is we had a young lady who arrived here from Puerto Rico in a wheelchair. That young lady was in a wheelchair that didn't have its proper braces. It was not in a condition that it could travel on a school bus, and it was not in a condition that was supporting her in the right way, and so her back was starting to arch. The Immigrants Assistance Center worked with that family, and within 3 weeks had the proper wheelchair for that child. And that family had gone almost the whole child's life without the proper apparatus. And so those things really make a huge difference. In addition to that, we've had North Star Learning Centers working with us, who are also represented here in the back. And what they have done is helped us to work with young gentlemen who are really struggling. And what we have is called a Tie to Success program. And what they're doing is they're teaching students leadership skills. And they're not doing it in the way that we normally are used to seeing. What they're doing is going to the cafeteria and they're saying to the children, I see leadership potential in you. I would like you to join our club so that we can build your leadership potential. Rather than saying, oh, by the way, I have a list of behavior issues here that you need to address. And so they're welcoming the boys in and they're working with them. The program is so successful that we've added another program to it called the Gentleman's Roundtable. So Tie Success starts in grade 6 and Gentleman's Roundtable goes on to 7 and 8. Our other partner that's working with us on that is Gifts to Give. And this year, Gifts to Give was able to provide 4 jobs for students this summer that were part of that program. One of our boys, the family was homeless. And ultimately, the only income they had was coming from Gifts to Give. And so they built an ability for that family to have some source of income to survive through the summer. And so these connections have made a huge difference. Also working with us is, new this year, is Dr. Finney and Jeff Smith, who are sitting in the back. Jeff Smith is a 2-time Olympian and a 2-time winner of the Boston Marathon. And he's going to be speaking to our students this afternoon about a running club and getting our students involved in learning how to run. And our goal is not to recruit this child who is already athletically stout and ready to run. We're really trying to recruit that child who can believe that they can run. And I'm so excited to have them here because I said to them, I need your advice as well because I'm planning on running my first 5K this spring. And I've just begun the whole process. And so I'm very excited to have them. In addition, this afternoon at a Spirit Rally, they're going to be introducing to our kids our new program called the 100-Mile Club. And ultimately, in our gym in the morning, if you ever come, and you're welcome to come anytime, we walk. And what happens is 14 laps equals a mile. So our kids will be getting beads for every lap that they walk. And ultimately, the goal is once they get to 14, it'll change from black and white to blue. And that'll signify a mile. Once they go to the mile, they will then get a gold bead. Once they signify 10 miles, they'll get a gold bead. Once they get 10 miles, 10 gold beads, they'll now be part of the 100-Mile Club. And that 100-Mile Club will open them up to a bunch of rewards at the end of the school year. And Dr. Finity and Jeff Smith already said they'll be back to help those students with rewards. And what I found out from Dr. Finity, interesting enough, is that he's already run a whole 100-mile race. So he's a great role model for our students. And so our goal is really to have data to go along with what we're doing so that we can really see how our kids are achieving. My beads are based on what I've done in the last 4 days. I'm building. And we're encouraging the staff as well. Our staff will be doing the same thing. This afternoon, our staff will get their first 1-mile bead at the end of our walk at the Howland Library to encourage them. Because not only are we looking at this from our students, we're looking at this from the perspective of the adults as well. And we have had now the biggest loser competition in this building for the last 4 years. And I hate to say it, I've been in it for the last 4 years, and unfortunately I haven't won yet because I've had people losing in excess of 40 and 50 pounds in one segment. So we're really taking this very seriously. The other 2 groups that I want to recognize is the South Coast Hospitals. They've been partnering with us for quite a while. They have the van outside today. Our faculty and staff are here to get cholesterol checks, blood pressure checks, and they've been doing this since I've got here. This wasn't something they just put into place today. It was convenient that they were here today as well, but this is not something we just did for today. We've been doing it all along, and they've been extremely helpful with helping to promote that within our staff, and our goal is now to build this to our students as well. Also, Child and Family has been here with us, adding extra counselors to our building to support the mental health issues that some of our children have. And they have been wonderful because not only have they been thinking from the perspective of time, they've been thinking about the perspective of culture. Because ultimately, you cannot access health care if you first don't understand the resources that are in front of you. So what they have done is provided us with counseling individuals who speak multiple languages. And that's key. That's key to health equity. We are not going to move forward if we don't open it up enough for children to actually get access and families to get access enough so that they understand what's going on. So I want to thank all our partners today. I want to thank you for being here today. And I want to let everyone know that Roosevelt Middle School's goal is to be a leader in this charge so that we can show other schools how to make all of this happen and really get children cognizant of their bodies and their minds so that we can move forward in a way that's going to be healthy for all of us and secure our future. So I want to thank you all for being here. At this time, I'm going to turn it over to Mary Ann Souza, who's going to introduce you to the rest of the day. Thank you.
And I want to acknowledge that Roosevelt is a very welcoming school, and we appreciate the support and all of the good work that goes on in the school every day. I have the privilege of representing two organizations today. I'm first of all here as the chairperson of Greater New Bedford Allies for Health and Wellness, which is part of the CHNAR, or the Community Health Network area service areas in Massachusetts, which is supported through the Massachusetts Department of Public Health with the goal of bringing communities together to promote health and wellness and to address issues and unmet needs and in various communities around the Commonwealth. In New Bedford, we are fortunate to have the Southeast Regional Health Office, which serves as a hub for our GNB allies groups. Many of our subcommittees meet there on a regular basis. It's where we have our general membership meetings as well. And our mission, the mission of the Greater New Bedford Allies, is really we're a coalition of individuals and organizations. We are actually servicing an area that represents several communities. So although we're here in New Bedford today, we have partners here that are representing towns like Acushnet, Dartmouth, Fairhaven, Freetown, Marion, Mattapoisett, New Bedford, Rochester, and Wareham, which is the service area that is comprised of the Greater New Bedford CHNA service area. The coalition that we represent, and many of, I would like to just see a quick hand. How many people here are already members of GNB Allies? We've been seeing a growth in our numbers over the last few years, and I think the excitement of programs preparing for the determination of need funding that was coming to us certainly added to the excitement of knowing that we would have some resources to help us do what we know needs to be done. And you'll be hearing more from other speakers shortly about that. Our coalition is really organized for the purpose of promoting health equity and community wellness. The coalition is dedicated to broadening the definition of health and wellness by engaging community residents, government officials, health and human service providers, business leaders, the clergy, and academia, which I also want to shout out for UMass Dartmouth College of Nursing students that are frequently here and welcoming in many of the activities we do. GNB Allies provides information on area resources and services, initiates opportunities for networking, which is again why we're able to do more with less sometimes. And we advocate for community needs, and we build on community assets, with special attention being given to celebrating and rewarding our community successes. And I think at the end of this opportunity today to share about our Health Equity Initiative, I think we're going to be seeing many more successes in the future. But it is because people are coming together, we're working together, and we're sharing resources to maximize the benefit. And I especially want to thank South Coast Hospital Group, because GNB Allies getting determination of need funds in response to infrastructure changes that they are making are helping to support important structural changes that we need to make in our communities. And I also have the added pleasure of being here as an agent of the City of New Bedford as the Director of Health. So I'm particularly pleased and proud to have you with us in New Bedford. And New Bedford is on the move, whether it's through our Mass in Motion initiative, through initiatives like the Health Equity Initiative, and through many other initiatives that will begin to unfold in the next several months as you hear more press releases talking about exciting things. So I want to thank you, and I would like to invite Ron O'Connor from the Southeast Regional Health Office to continue the dialogue. Thank you.
Thank you, Marianne, and thank you for your leadership of Greater New Bedford Allies for Health and Wellness. This is a very gratifying day for me. I've been involved with Greater New Bedford Allies since its inception as the Community Health Network for Greater New Bedford nearly 2 decades ago. And over that period of time, they've had enormous success around domestic violence, maternal and infant mental health, access to health care, and youth development. This is just another milestone in their history. And I in particular know that this will be successful because I see the people that I've worked with and the relationships that we've built over the last 2 decades will make that happen, but also because the core partners in this, the Department of Public Health, South Coast Hospitals Group, and Greater New Bedford Allies all believe that health equity can be achieved, that it's a necessary and achievable goal. And that there's also the capacity within this community of community health workers, that we all recognize that community health workers are a necessary and essential part of a reformed healthcare system and as members of the public health care team. And lastly, it's my pleasure now to introduce, I've had the pleasure of working with Pauline Hamill for the past year or so as the coordinator of Mass in Motion, and then when the idea came, well, we need somebody to coordinate this health equity initiative, it made perfectly good sense to involve Pauline in this initiative as well, because this is part of, well, she'll use the word convergence, and I'll let her have that, but I'll throw it out there. I just think this is a great thing for Greater New Bedford. I'm just a real privilege to be here today. Thank you.
Welcome, everyone. This is such a wonderful day for us. I've already seen a few of you, including the mayor, at our International Walk to School Day as part of Safe Routes to Schools, and we're going to continue that momentum later this afternoon. But many of you do know me as the coordinator of New Bedford Mass in Motion, and when the opportunity came up for me to also work with the Health Equity Initiative, it just seemed like the perfect match. Because if you really think about it, you can't be out there talking about promoting physical activity and better nutrition, better eating habits if you don't look at the disparity issues that exist. It's in your face. And we can talk about having kids go to the parks and walking on the sidewalks, but we need to know that families believe that those are safe places for their children, that they are not at risk. We can talk about eating more healthy foods, but if you live in a neighborhood where you have a food desert and there are no fresh fruits and vegetables, then we still have a lot of work to do. So a lot of great accomplishments here in the city of New Bedford. It has been quite the ride. You probably could see some of the PowerPoint slides, which tells a little bit about the history of the Health Equity Initiative and how we started out thinking we were going to hold town hall meetings and bring people to us. And then we quickly learned, no, you have to go out there, where they are, and participate in their events. And so that's why you see some of these photos from health fairs and the cultural evenings, the cultural night that was held here at Roosevelt, also in the Tri-Town area, and in Wareham. So we really have learned a lot from the community, and I have to say that as we've built capacity for Mass in Motion, and we've really solidified partnerships, it's just been a great opportunity to keep talking about the need for the health equity initiatives that we want to see here in the state. I'm really honored and thrilled that you put out the invitation. The next thing you know, you've got the local, state, and federal level showing up at your event. This has been a great day for us. And I also want to make sure that you remember after this event, we will have, after the speeches, we will have a luncheon. And that will be followed by this wonderful rally that Darcy Fernandez has mentioned, where we will escort the students out of the building as well in terms of participating in the International Walk to School Day. So if you can stay, I hope you have your walking shoes, because I'd love to see you do a little walking around the neighborhood with Mr. Jim Rattray, who is the Vice President of Marketing for the South Coast Health Systems.
Thank you, Pauline, and thank you, Ron and Marianne, for your leadership on this, and Darcy for getting us off to a rousing start. It's a great introduction. We are very excited to be here today. At South Coast, we are very focused on the needs of our communities. It's the reason we have brought advanced heart care, comprehensive cancer care, and a whole host of other health services to our region. It's why we are continuously having conversations with our patients, our neighbors, and our community organizations about improving everyone's health across our region. And it's why all of us at South Coast are proud of our role in this major health initiative. The Greater New Bedford Health Equity Initiative is a shining example of how South Coast Hospital's community benefits investment can make a real and lasting impact on the health of our communities. We serve a region that has some of the highest rates of chronic disease in the state. Our residents are struggling with and dying of heart disease and lung cancer more frequently than residents in other parts of the state. Their lives are constricted by chronic health problems such as diabetes, hypertension, and asthma. And they grapple with the risk factors that cause these diseases: smoking rates that are double the state average, high rates of obesity, and significant substance abuse issues. Our residents also have social and economic challenges that affect their health: unemployment rates among the highest in the state, high school dropout rates that approach 50% in some areas, and high rates of violence among our youth. But these are our patients. These are the people we care for every day. And to truly meet and treat their health problems and improve their health, we at South Coast know we need to care for them outside of the hospitals, in the communities, not just within the hospital walls. That is why our partnership with all of you is so vital. One of the key components of health reform, both here in Massachusetts and nationally, is providing care for patients in a collaborative way. It's often referred to as providing a medical home, or being accountable collaborations that help patients maintain their health rather than simply treating their disease. And we're committed to this process, and we believe it will ultimately make our region a healthier place. This health equity initiative helps South Coast reach into our towns, into our cities, into our neighborhoods, connect with our most vulnerable residents, and have a positive impact on their health. This is the cornerstone of the Community Benefits Program at South Coast and defines our mission as a not-for-profit healthcare institution. I know Keith sends his very best, and on behalf of Keith and everyone at South Coast, we thank all of you for the important work that has already been accomplished. And we look forward to the growth and expansion of the Health Equity Initiative over the next several years. We are all breaking new ground together in discovering new and better ways to improve everyone's health care on the South Coast. Thank you.
And now it is my honor to introduce our Honorable Scott Lang, Mayor of the City of New Bedford, to speak about the role of local government in healthy communities. Mayor Lang.
I think that this is an important event because it signifies something that the people of this region need to be assured of, and that's that we are not going to let anyone fall by the wayside. And what it really comes down to is that if you look at actuarial tables, which I've been doing for many, many years in different roles in my private life, you'll see that the actuarial tables for different individuals in certain communities and minority-based communities are often much lower than the life expectancy of individuals who are in communities that are Caucasian-based. You will see that there is, when you look at different incidents of whatever it might be alcoholism, it might be drug abuse, it might be victims of violence, you'll see that there's a disparity throughout communities. And it's something that when you are trying to build the strongest possible family-based communities in a region, it stops you cold, leaves you to pause and try and think, how can we make sure that every little boy or girl or every adult or every senior gets the same opportunities, the same health care, the same opportunity for education as the other. And I think this health equity initiative by South Coast is something that begins to address that and speak in a very important way. The first thing I want to say is that this is all about partnerships and collaboration. As Jim said, and I'm sure Keith would have indicated today, the City of New Bedford has a tremendous partnership with South Coast. Not only the hospital itself, but all the different programs that they offer our community and take advantage of it for our citizens in a very, very vigorous way, and quite frankly tap the resources of South Coast, perhaps to the point where they wonder if it should be part of our government rather than something that we rely on as a partner in the nonprofit healthcare sector. The other thing I want to say, if you're talking about partnerships, we've had a fantastic partnership with the Patrick Murray administration. Secretary Bigby, who I was with last week, talked about these issues for a few moments, and Commissioner Arbach, who is here today on behalf of DPH. We've had a tremendous partnership, and it goes back for the last for 5 years when the Patrick Murray administration took office. My goal has been to make sure that every resource that the state has that's available, New Bedford and this region have an opportunity to avail ourselves of, and it's been very important for every segment of our society, every age group. I want to thank the Commissioner publicly once again. I also want to say that we have had, Rear Admiral Milner was here, I believe, about 6 months ago. And then I saw him again in Boston, and he represents the federal government's commitment to this area. And I'm going to speak for just 1 minute on the breadth of that commitment. But the fact is, it's always great, as Principal Fernandez said, when you are tackling issues that are profound social, economic issues, that you have not only your local government working very attentively with their school department as well as state and federal partners, and we have great partners. And then I'll throw out just a very quick thank you to Mary Ann D'Souza, who is the Executive Director of the Bedford Department of Health, as well as the Board of Health. We've got 3 dedicated members, terrific members, Andrea Schweidenbach and Exa Forrest, who are just absolutely top of the line as far as community service and caring about our people. And then Pauline Hamill, who has been involved now in Mass in Motion and who has tried to bring this right back to the grassroots. So let me just say a few things on why I think this is important to be here at Roosevelt, why it's important to be in it. This isn't about health care. When we're talking about health care, the cart is already out of the barn. A long time as a health teacher. Every time I see Deb, she says we need more health classes. We need more opportunities for our children at the earliest age to start learning about their bodies the same way they figured out a computer program, to learn about the health of their families the same way they learn about their favorite hobby. We're experts on everything except our own health and our family's health. When we have a question, we end up going to a amorphous ask the doctor computer program, and as soon as you read that, you know you'll be dead in a week, right? The other thing is that we rely on our health care. We do our diagnoses by reading Ask Doctor whatever it is in the Standard Times. And you see a glimpse of something. It says, you know, sometimes I get a little winded. The person writes in, man or woman. You read it, before you're done, you have what they have. The fact is that we need to learn. We need to learn about ourselves, about what we can expect from the time, you know, that we're aware of our own bodies, right up through until we get into our senior years and our golden years. And we need to be able to avail ourselves of the best possible health care when it comes to things such as a physical on a regular basis, things such as diagnostic treatment when someone says, or an insurance company says, I'm sorry, but that test is probably something you really don't need. We need advocates who speak all languages to say, no, actually, this is regardless of your address, your zip code, regardless of what your educational attainment is, regardless of what your profession is, this person really does need this test. We get this test, we're going to promote several things. One, hopefully wellness, in that we'll treat this condition. Secondly, we'll get a productive member of society back. Third, we will plug this never-ending hole of healthcare drain because we don't get to the problems early enough. We end up instead of being able to patch a hole in a leak, we end up having to take the wall down and put it back up as an analogy, rather than hitting it early. So it's very, very important. Education is the key. If you have X, Y, or Z, it's important to go to a doctor. If you have X, Y, and Z, it probably makes sense to go get some Robitussin at the drugstore. If you have X, Y, or Z, get to the emergency room. If you have X, Y, or Z, when you get a chance, get a physical. But the fact is, we need the education right here in our schools, so our children, who, by the way, bring everything home, every single thing home. Our kids will diagnose their parents, their brothers and sisters, their grandparents with just a little bit of education. Granddad, you got to get to a doctor. Or Granddad, you ought to take an aspirin, right? Whatever it might be. But the fact is, this is an important topic. And we don't have to reach the borders. We don't have to go to the edges where we're starting to question what the heck were we teaching our kids in school today. But it's just the very basics. Health, wellness, safety, good citizenship. All that then leads to tremendous learners, and that's what we really need to do through these programs, and that's why I love this particular program. The other thing I want to say is in closing, is this. This also goes with environmental issues, making sure that we provide the best environment for all of our citizens. Environment may be from the standpoint of pollution, clean air, clean water, you know, making sure we don't have toxins that we're coming into contact with. It may also mean environment safe neighborhoods. Get the guns off the street. Get the violent video games out of the house. Get the kids and not exercising thumbs, but exercising their bodies. Change the way a neighborhood looks. A lot of green space. You know, beginning to change the streetscape. So you see the people with their strollers and out on the street feeling comfortable. And that's not only in New Bedford, that's around America. The other thing is getting at real education reform so that everybody can attain. Not driving kids out of the system and also not failing kids who've done everything that they were required to do to get a high school diploma other than pound their way through a one-size test. And then last but not least, a school lunch program. School lunch program. I've been in and out of the schools. I just want to say this to finish up. Let's talk about health. We are more concerned about what kind of gasoline we put in our cars than we are about what we eat. And our kids pick that up to begin with. So here's what our problem is with school health. And we're all trying, and Darcy's trying, everybody's trying. Larry Finnerty is here today. He is, he's one of our school committee members. He's been through in the school system all his life, I would say. Short sabbaticals, but all his life. We've yet to see a school lunch program here or anywhere in the United States that really puts the emphasis on health, that puts the emphasis on this is what we want our kids to eat. You have to shy away from what they serve to pick and choose things that are healthy. You know, at any given time, I've been through the schools, the little kids come in for breakfast, you're heartbroken, they get a Pop-Tart. Now Pop-Tart, I love Pop-Tarts, but not for our kids for breakfast. And I am a do as I say, not as I do when it comes to this. But the fact of the matter is, this is pretty simple. This is a national issue regarding out of shape, obesity. Jeff is here today. This running program is going to be the greatest thing in the United States. We will produce the best students, the best student athletes, and the best citizens around physical activity and learning. It's a fantastic program. Along the way, maybe we'll get lucky and hit some young boy or girl or young man or woman who gets scholarships. Perhaps they will get scholarships for the academic acumen as a result of making sure that they got great grades in order to participate. They may get scholarships because they're great students and they also happen to be terrific athletes. But the point is, it takes all these different component parts. Getting back to school lunch and school breakfast, it seems to me we ought to sit down and come up with a healthy menu that the federal government adopts and then tells Kellogg's or whoever it is, this is what we're going to produce now. The idea that ketchup is a vegetable, the idea that a fruit tart gives you the fruit, the idea that at lunchtime, I love hot dogs, but at lunchtime a hot dog, let's figure out what we feed our kids. And we could start right from there. We did something with Dr. Finnerty several years ago. We took and this killed me more than anything, we took all the sugary sodas and stuff out of the schools. And it was something that was absolutely right to do, and I see kids all over the city now who are slimmed down, look much better, just because they're not drinking this sugar, by the buckets full and having it come out of the school system. We need to follow South Coast's example here on health equity and do this across the board in every component part. So this is a great program, great start. I know Mass in Motion, we've got some great things coming up in the near future. But this is the way you change an entire generation, just by simply saying we're to start concentrating, going to get away from the so-called 21st century modernism and get to the 21st century modernism that includes physical fitness, healthy neighborhoods, healthy families, and I think that's what this is all about. So I'm very happy to be here today. I am very honored to have the Admiral and the Commissioner here as well. So thank you very much.
It's my honor to introduce our Commissioner of the Massachusetts Department of Public Health, John Arbeck, to speak about the commitment that we have to health equity and our community health workers.
Thank you, Pauline. It's really a pleasure to be here. I love coming to New Bedford, and I love coming to New Bedford because I think it symbolizes this important campaign that we have that we refer to as Mass in Motion. And I would say that's because New Bedford is in motion. New Bedford really is a model community in terms of many different initiatives. And I want to talk about four that I think are important in terms of really turning around the health of the residents of a community. The first thing I would talk about is the importance of leadership. And here I would say, Mayor, thank you for your leadership. There is truly no mayor in Massachusetts that has focused more attention on the issue of health. I talk to Mayor Lang, must be twice a month, and it's always about a health issue where he is advocating on behalf of the people of the city to make sure that we're doing the right thing, that we're aware of an issue, and that we're doing everything we can to bring resources into the city. And I would tell you, that's made a difference. It's made a difference in terms of our focusing attention on New Bedford. New Bedford also has a great leadership in its health department. And Marianne, where's Marianne? Marianne has done a great job as a partner, and the health department, the local health department is critical. Without a leader like Marianne and a health department in the city that's focused on these issues, we can't make the advances we need to make on all issues, from vaccination to reducing risk for heart disease and cancer to addressing issues of substance abuse. So thank you, Marianne, for your leadership there. South Coast, I think, has done a great job. And, we have a determination of need program where the hospitals, when they come in and they're going to make an investment, we talk to them about making an investment in community health. And South Coast has been a great partner in terms of that. And the reason is they are so connected to the communities they're in. So I think funding of this program through that process is great, because it was really being a partner with the community and focusing the attention where it was needed in such insightful ways, working with the Chana, working on focusing on disparities, focusing on the important cancer screening issues, which are critically important, and focusing on community health workers. So leadership really matters. The second area that I would focus on is the importance of promoting wellness. And by wellness, this is some of the issues that the mayor talked about. If we focus our attention on what happens when people are sick, we can work on some of the health cost issues, we can focus on overcoming access, but we're not really winning in those situations. The situations where we win is when we keep people healthy. If people are coming in with lung cancer and we're giving them the very best treatment, well, that's good. But it's much better if we prevent them from getting lung cancer by working on issues like preventing smoking and tobacco use, and very importantly, working on eating well and exercising. But on the issues of cancer screening, very important. We know if you reach people, they screen for cancer. Screening gives you an opportunity to present a message about the importance of prevention, but if some people are positive test results, we can get them into care quickly. That makes a big difference in terms of sustaining their health. And there is, we've got across the state now Mass in Motion programs in many different communities. I would tell you there is no stronger Mass in Motion initiative across the state than there is in New Bedford. And Pauline and the team that have worked here, I read in the Standard Times an article about Mass in Motion, it seems like every month. I don't know how you come up with a new twist to get some article that talks about the new approach, but that raises the consciousness, I think, of the population, that you're doing things, they're high profile, and they're making a difference in people's lives. So Mass in Motion is all part of that second area of importance, promotion of wellness. The third area that we're very committed to is this issue of health equity. And what we mean by health equity is, as the mayor has said and as others have said, we know that people are not equally affected by risk, that conditions in people's lives, conditions in people's homes, workplaces, communities affect their health. And so we have to really work on creating conditions which make it most likely that the healthier behaviors are going to be the easy behaviors. So Principal Fernandez, hearing what you're doing is exactly the right thing in terms of overcoming health equity. Creatively, enthusiastically reaching kids at this age and helping where there are those barriers that you talked about in people's families, helping them get over that. So focusing on health equity in a city where you have a diverse population of Cape Verdeans, Azorians, Portuguese, Latinos, other populations where people are going to need special attention on language and culture in order to have that full access. That's great. So this is I love this program, the Health Equity Initiative. And finally, I would focus on the importance of recognizing the value of community health workers. We talk about this a lot, and you'll be hearing from Elisa Renee about the importance of community health workers. We're thinking a lot now, the governor's thinking a lot about controlling the cost of health care, making sure people have access. We've been successful at that. Working on the issue of high quality, we've been successful on that. But we really have to think creatively about how do we change the conditions in a healthcare setting and in the community and make those connections. And as we've looked at what makes a difference in terms of quality and controlling cost, it's often the inclusion of community health workers as part of the team. And that's because there's really only so much that a doctor or a nurse can do in a 15-minute visit. That's 15 minutes. But then people go back to their homes, or they leave the doctor's office and they say, what did I just get told? Or they need some assistance in making the connection to the follow-up visit, like, okay, now I have to make an appointment for the screening, maybe I won't do that, you know, I've got to focus on the other things in my life now. So having the community health worker there to assist, to provide the education, to provide the support is key. And so again, in New Bedford, drawing attention to community health workers as part of dealing with health equity, as part of promoting wellness, is really brilliant. And so thank you to New Bedford, to all of you, for providing a leadership that is not just for the residents of New Bedford, but is really setting a model for people throughout Massachusetts of the way a community can come together, think creatively, make a difference. This city is doing that, and it's setting up an example, I think, for not just the state, but for the rest of the country. So thank you for your work.
It gives me great pleasure now to introduce Ms. Lois Johnson, who is the Assistant Attorney General for Healthcare, and she will be talking to us today about hospital community benefits and health equity. Lois.
Thank you. Good morning, and apologies from the Attorney General, whose schedule didn't permit her making it down to New Bedford today, but she sends her best. I'm delighted to be here at this great event, and on her behalf, I'd like to say just a few words about the work of the Attorney General in terms of addressing the goal of health equity. Since she took office, Attorney General Coakley has made protecting healthcare consumers a key priority. She dedicated a division of her office, the healthcare division where I work, and she also works in healthcare in the antitrust division, Medicaid fraud division, the nonprofit charities division, and throughout all of these divisions in her office really strives to protect healthcare consumers and ensure that everybody across the Commonwealth has access to affordable, quality healthcare. In all of these connections, she's tried to seek out opportunities to address health disparities. First, she's an active member, I serve as her designee, of the Health Disparities Council, where we're working to promote strategies and policies to reduce disparities in a variety of ways. Pleased to be here with Georgia Simpson-May of the Office of Health Equity and others who serve on the council. And second, we've used direct resources to put out into communities across the state to address health disparities. This year, we distributed $1.5 million through our healthcare grant program. These were funds that we received from settlements and consumer protection cases in a variety of healthcare matters. We designed the program to develop innovative projects in communities to address health disparities, to improve community health. For example, we have programs in community health centers that deal with the treatment of chronic diseases, have active case management so that addressing the types of chronic disease that affects people of disadvantaged communities more than other communities. We also have funded programs to provide outreach to expectant mothers to reduce the incidence of low infant birth weight. And the third area that I want to talk about today is community benefits. And that's where we have used the community benefit program of the Attorney General, which is where we set expectations for how nonprofit hospitals and HMOs should fulfill their community benefit obligations as charities. There, we've identified reducing health disparities as a priority, and it's not a requirement, but we are encouraging hospitals and HMOs when they conduct their community health needs assessments And when they decide where to direct their critical charitable resources, we've said, look through the lens of health disparities in your communities, and through that, maybe that will spur some thinking about innovative solutions, new programs that you should do that can really collectively move the dial across the Commonwealth, hospital by hospital, and HMO by HMO across the Commonwealth, and using harnessing the value of those community benefit dollars. So I'm particularly pleased to be here today to support the work of this initiative, which really does represent the kind of partnership that we are encouraging hospitals and their local communities to do in the Community Benefits Program. It seems that not only just in terms of the giving of resources, but by developing those key partnerships all across your community to identify the problem, you're well positioned to develop some strategies and solutions to that problem. We are looking in our community benefits program for reports back for all of these initiatives. We want data. We want to get information about the goals that you set and how you've achieved them, so that we can make that information public and hopefully replicate your success across the Commonwealth. So we support your effort, and we really look forward to see the great results. Thank you.
Executive Director of the Mass Association of Community Health Workers. She will speak to us today about community health workers and their partnership in health. Thank you.
Good morning, everybody.
Good morning.
I just want to say that I am thrilled to be here this morning for lots of different reasons. The first is that the work that you all are doing here is amazing. So I want to echo the comments that we've heard from the other speakers this morning. Secondly, the fact that you're integrating community health workers from the beginning excites me an awful lot. And then third, because the work that this particular program will be doing to expand and increase cancer screenings has a special place in my heart. My mother, who passed in 2005, had been a 4-time, 25-year breast cancer survivor. She was also a CHW. She became a community health worker for a couple of reasons. One was because she felt it was really important to get the word out about early detection to both men and women in the community where she lived. She wanted early detection to save one other person's life. She also thought it was very important to have support systems in place to help newly diagnosed men and women navigate the healthcare system. And thirdly, she became a huge advocate for funding of early detection, community health, and community health worker programs. So know, as you're going forward in this work, that you've got people all over the state who are supporting your effort and hope to see many of these efforts replicated. So I was asked to talk a little bit about community health workers and our role. But before I do that, I want to ask everybody in the room just to close your eyes for just 1 second. And I want you to think about that wonderful spring day that is really warm outside, but it's raining. And so you're digging in your bag and you pull out your umbrella and you open it up. And on this particular day, things start falling out of your umbrella. Words such as community health advocate, community coordinator, patient navigator, community coordinator, community health representative, and hold on to that visual. You can open your eyes. I just want you to hold on to that visual as I talk for a moment. When you think of community health worker and the term, think of that umbrella. I'm excited that it appears as though everybody here understands what a community health worker is and has embraced that term, but know that many different job titles encompass community health worker. In our state alone, a few years back when DPH released a report, there were almost 50 different job titles for community health workers that were falling out from under that umbrella. but we're all part of the same workforce. And so as you go forward with your program here and other programs that you may develop, please keep that visual in mind. I want to share a quote from a community health worker. And some of these quotes that I'm going to share with you, just want to give credit where credit's due, are coming from the 2009 DPA. So this community health worker was asked, what makes us different? What makes you different from other people that you work with? And one community health worker answered, what makes me different from the people I work with, from my colleagues? I am who I serve. We are from the communities that we serve. I'd like to share another quote about why we're different. We connect people with other services to create a more coherent chain that people can follow. That's the extra mile and the extra connection that's provided by a community health worker that nobody in the clinical office has the time or the flexibility to do. So those are what things that make us unique, make us different, that highlight the importance of including us in care teams. And it sounds like you all are already on that path. I want to say that your model here is building upon some models that are happening across our state, that are happening nationally. But the difference, one of the differences of your effort is that it's a true collaboration between community organizations, between local government, between state government, and community health workers are part of that discussion. And so that excites me. And you understand that it's bigger than the screening. That if we only had to have screening services available and people came, many of us would be out of business. It might be a good thing, but we'd be out of business. But the fact of the matter is that it takes that extra nudge, that extra connection that community health workers have with communities to make sure that people access those screenings, and then to help them navigate once they've been diagnosed. When we talk about or think about community health workers and health disparities, there are a couple of things that it sounds like you all know, but I have to reiterate just because I'm who I am, that we help to improve health amongst the most vulnerable populations in our areas. And we also help to address some social determinants of health, which many people in their various roles may not have the time, the extra time that some of that may take, may not have the extra resources, may only have 10 or 15 minutes with a patient. And it's really difficult if you're trying to address that one health issue than to look at everything else that encompasses a person's health. And that's part of what we do as a workforce to reduce disparities. And we're getting lots of recognition for this work. You've recognized it here in New Bedford. The state's recognized it. The feds have recognized us. We're getting recognition in many different places. So know that the work that you're doing here is in line. You're in the forefront of things that are happening across the country and here in our own state. Understanding the role that we play, what we have to offer, how we can assist to enhance the work that many of the providers are already doing. It takes a team to have a healthy person, and community health workers are thrilled that we're part of the team here in New Bedford. And I would just like to close by telling you just a little bit about the Mass Association of Community Health Workers. We're the statewide professional association for community health workers for you. Our membership is community health workers and community health worker supporters from across the state and the region. And we also have some members from other states across the nation. People want to know what we're doing here. We're on the forefront of many different issues, including community health worker issues. We're based in Worcester right now, so it's a little bit of a trek to get here. But part of what I want to say to you about Machwa is that we will be spending lots of time in the regions in the next few months. So to please watch out for us, to host meetings here in your region, to please be engaged in the efforts. It's really important that we take hold of things that affect the work that we do in our communities every day. So I just want to close by saying, please be engaged with Machwa. Be engaged with the work that you're doing here in New Bedford. Continue to work together No one group of folks can do this alone. And continue to be supporters of each other. Continue to nurture the CHWs that you have, that you'll be working with. Our time is now, not just for working towards health equity, but for promoting the community health worker workforce. And thank you for the effort that you're making to do that here in New Bedford.
And so here he is, and it really is very exciting for us to have Rear Admiral Michael Milner, who is the Assistant Surgeon General and Regional Administrator for Region 1, U.S. Department of Health and Human Services. Today he's going to speak to us about the national strategy to eliminate health disparities and probably a couple other things if I know him. All right, welcome.
Thank you, Pauline. Wow, it's really hard to follow comments from Lisa Renee and the other distinguished presenters this morning. It's an honor to be back in Roosevelt. I walked in this morning and went straight to the principal's office, which I really thought was a nice thing to do. I got my badges. I wear my mass and motion pedometer, and I keep track of my, every day I go on the President's Challenge website and I log my steps. But I'll tell you, Darcy, I'm really looking forward to getting a bead today. That's my goal for today, is to get that bead. Pauline asked me to talk a little bit about the National Partnership for Action to Eliminate Health Disparities, the national stakeholder strategy to achieve health equity. I believe that the other presenters really took away, they presented the key points, and each of them in their own way, in their own venue, described the components of the National Partnership for Action. Commissioner Arbach talked about the community and the importance of the partnerships that we have at the state, local, federal level, at the community level. The mayor talked about education, which is a part of this, which is educating all of our children and our communities about things we can do to improve our health and improve the safety in our communities. Lisa Renee, in her poignant words, talked about the value of our community workers, those the glue that brings the fabric of our community together and brings the parts of the healthcare system to the community where wellness can take place. The Representative Lois from the Attorney General's office talked about the need for data and how that data will then help us make the right investments and to move forward. This particular strategy, if you can just hit the slide, I promise I won't kill you with PowerPoint. But these are the things, the cultural component that Lisa Renee described, being able to, and the mayor actually said that as well, knowing the language and the culture issues and being able to connect those dots for those clients, those patients. The other piece that I thought was important that Lisa hit on was the workforce. There's no question that we have to improve the ability to provide care at the community level, and the federal government learned from Massachusetts when we rolled out the Affordable Care Act. We learned that you can't just give everyone a health insurance card or an access point without having the workforce to provide it. And so during the stimulus bill, the AURA funding invested in community health centers where we're training the next generation of workforce, the community health workers who can become the next level, the next generation of nurses and physicians and doctors and researchers. I mean, it grows from the community. So the federal government's making that investment, and the state of Massachusetts has been a recipient of a number of significant grants to help build that workforce. The collaboration with the communities, we talked about awareness. I mean, people don't know unless we talk about it. And I say we, and that's every one of the parents here, that's everybody who's a member of a PTA or a Girl Scout troop. You've got to talk about the disparities. People, they say, oh, that's somebody else. That's somebody else in another part of town. It has to be, as Lois said, the fabric of our discussions around health and wellness is everybody in the community has different needs, and we've got to help raise the awareness about the disparities and the differences in stroke risk and cancer risk and other kinds of things that help people understand this. I'm not able to lobby Congress, but all of you can. And if you're educated about the provisions of the Affordable Care Act and the components that really make sense, we've got to talk about it more because it's under some threat. And so I don't get in trouble, and I don't know if there's press here, but it's okay. I'm allowed to talk about this. I got approval to do that. But make sure that you talk about the provisions of the Affordable Care Act that are prevention focused, that make so much sense. If we don't make those investments upstream today, we won't have the cost savings and the improved quality and the better outcomes on the other end. And you know, the big piece for me is, I look at my mom and I say, you know, she might be entitled to another knee in 10 years or 15 years, but is that a good investment? If we could do things upstream and make those investments and help, you know, our grandchildren and our children and our, you know, improve with immunization and prenatal care, all those kinds of things, we've got to make those investments upstream. And yes, our seniors are deserving and entitled, and we've got to provide those services, but I think it's hard to understand that upstream stuff that we have to do. I mentioned to Lois earlier, we've done incredible work here in New England around asthma, and we've shown that if you invest small dollars with community health workers, health educators, nurses, reduce the mold and the pests and show children and parents and families how to use their meds, you cut down on ER visits, you cut down on ICU visits, you cut down on lost work days for parents. And many of those parents, if they lose a day of work, they lose their job. We've seen that, we've proven that, and the Secretary actually cited work we've done in New England in a letter that went to the governors this past spring. Don't cut people off of Medicaid rolls or off your insured rolls. Look at these upstream investments. So I got off track, I apologize, but it's a passion that we've all got to pick up and we've got to talk about, because it's the prevention piece is proven, it's real, it works. Massachusetts has demonstrated, and so the more we do to educate our communities, all of our friends and neighbors, the better we'll be. And I also want to, just sort of that was the piece. I mean, there's a huge commitment from the federal government. It's funded through ACA, but it was going on before the Affordable Care Act was passed. This work has been known for a long, long time. And in 13 years that I practiced in the Indian Health Service, I saw that disparity in my face every day as a clinician. So I want to thank you for what you do every day and how you're helping us. But I also want to thank Georgia Simpson-May for just this little two-pager, one page of paper, because this really hits the nail on the head. And if you look at that, it was left at your chairs. It really goes over the reasons for the strategy for eliminating health disparities and improving equity. And on the back, I looked at this and I thought, you know, Darcy's covering goal 2, objective 7 with youth. You know, the mayor described education, that's goal 3, number 12. I mean, everything that was talked about here is covered on this piece of paper. So congratulations for what you do every day. Thank you. I'm looking forward to getting my bead later when I do my walk with the kids. And thank you for having me here today. I appreciate it.
So we've gotten to the point of the program where we will be talking about the partnerships in action. We will be going to lunch soon. But first, I'd like to invite Jim Rattray to come up and Ms. Marianne D'Souza to accept a nice...
And we're thrilled to have an opportunity to partner and use these dollars well to make a real difference in our region, in our communities. New Bedford, as you know, is the hub for this particular area, but we have many communities that we hope will benefit from the funds, the utilization of building, actually the utilization of community health workers, and continuing to build the capacity to have community health workers that are so vital to the very fabric of our communities be recognized, appreciated, acknowledged, and at the same time realize together we can, together we will make a change, and we are. On that note, again,
this has been a very exciting day for Greater New Bedford, and at this point we have a luncheon available for those of us who are, I think we've earned that, we've got that appetite, and a healthy lunch, Darcy has assured me. And just remember, there's a rally following this, and also a walk away from the school at after the dismissal, 2:30 or so. But I first would like to encourage you to get some food and sit and talk with some of our community health workers that are in the audience today, and keep the momentum going. I think that you have all the basics now. You've heard from all the dignitaries and these esteemed speakers, and let's go do it. Let's do it. Take care. Thank you.
Tila, welcome to Roosevelt. How you doing today? That doesn't sound good. How you doing today? No? Well, you're here for two reasons, okay? Two reasons. One, we want to teach you how to be healthy. Okay? We want to teach you how to be healthy today, and we want to promote you being more active. So what is going to happen today is two things. One, we're going to have this guy coming to me. He used to be a big Olympian runner. He's only going to take